Yeah, thank you very much, Brian, for this very friendly introduction. In my talk, I will focus not on depression, this time on schizophrenia, and not as much on the mechanisms, more in some of the clinical aspects. As I mentioned already yesterday, I'm coming from the Munich hospital, where beneath others, Emil Kraepelin was one of the directors, and Kraepelin, he described the classical dichotomy, the classification of psychiatric disorders or of psychosis into, on the one hand, manic depressive insanity, manisch depressives Irresein, and dementia praecox. This is a concept what is similar, not the same concept as schizophrenia, but similar as schizophrenia. Kraepelin put more weight on the cause of the dementia praecox. That means, in contrary to manic depressive illness, the cause of the dementia praecox is a more chronic cause, and only seldom the patients get sane again. Ed Kraepelin also, he was a pioneer in psychiatry. He also described a relationship between psychosis and infections. As early, he described the dichotomy in 1899 in one of his textbooks, but 9 years earlier he already described the relationship of psychosis after influenza. So that is the relationship between infection and psychosis. It's not anything new, but looking to the mechanisms, of course, this is a new topic, and there are a lot of arguments in the meantime that schizophrenia may be related to an inflammatory process, possibly not the whole spectrum of schizophrenia and not all patients of schizophrenia, but a big amount of these patients. I will come later a bit to the role of the genetics, of the immunogenetics. There are a lot of findings in the meantime describing that the pro-inflammatory cytokines are increased in schizophrenia, and there is, for example, these are only examples showing that increased levels of the interleukin-8 pro-inflammatory cytokines in pregnancy during the second trimenon predict an increased risk for schizophrenia, and there are in the meantime several findings that the infection during pregnancy, and especially during the second trimenon, they predict an increased risk. And there are, for example, also after the pregnancy in early childhood, that infections are associated with an increased risk of schizophrenia. For example, studies in Finland and in Brazil showed this during epidemics of infections. These are other examples in more than 10,000 patients showing that a genetic risk is associated with schizophrenia, and risk on the chromosome 6p22.1 and this is the region where the MHC, the human HLA system, the immunogenetic system, is located. And there are other studies showing, for example, that the complement factor 4 is also a genetic risk gene for schizophrenia. Coming back to the aspect of infection, we performed a study some years ago looking to different titers of infectious agents, chlamydia, trachomatis, toxoplasma, EBV and HSV, herpes infection, and what we could see that there was not not an increased titer of any single infectious agents, but we could see a so-called susceptibility index. That means a tendency to more positive titers against different infectious agents in schizophrenia. So that means apparently there's not a specific infection that may increase the risk for schizophrenia, but the fact that that there is a kind of infection and inflammation. And this is the same what has been shown in different animal models. Animal models, on the one hand, with the poly-IC, and poly-IC is an immune activator that mimics a viral infection, and on the other hand, lipopolysaccharides are also activators of the immune system which mimic a bacterial infection. And for both of these immune activators, the outcome was more or less the same in these animal models, that the induction of this immune activation in pregnant mothers increases the risk for a schizophrenic outcome of the offspring later. We have already heard about different infectious agents in the bacteria, and this is an interesting study looking to bacteria in throat and also in fecal samples in schizophrenic patients and controls. This is a kind of pilot study showing that there are in schizophrenics there are different bacterial agents that are, compared to controls, much more increased in both in fecal samples and in throat samples, as you can see here. I don't want to go too much into details, but we know from different studies that the microbiomics seem to play a big role there are until today not too much studies, but this is a hot topic from my point of view. For example, normal gut microbiota modulates the brain development and the behavior, and also are associated with neurodevelopmental disorder, and for example also regulates the hippocampal serotonergic system. So there's a strong connection between the microbiome and behavior on the one hand, but also between the neurotransmitters on the other hand, the so-called gut-brain axis. And I think in the upcoming years this will we will see a lot of interesting results from this topic. And the microbiomics are more or less the totality of the microbes, genomes, and the interaction with the environment. And we know that it plays not only a role in classical infectious diseases, but on the one hand in the pathology, and there are arguments that also in the resilience, for example, for skin disorders, autoimmunity, and there are first results that they also play a role in psychiatric disorders. And I think to understand these interactions is one of the challenges of the near future. I have told about the risk of inflammation and immune activation during pregnancy for schizophrenia, but not only pregnancy seems to play a role, but also inflammation, not only during pregnancy and infancy, also in later life. And I will show you the data of one Danish register study from healthy persons born between 1945 and 1996, and the authors looked to nearly 40,000 schizophrenia cases, and they looked whether there's an increased risk for schizophrenia with an association of an autoimmune disorder or an infection. And it is only hospital contacts are registered, hospital contacts due to schizophrenia, but also hospital contacts due to infection and to an autoimmune disorder. And what you can see here are the incidence ratios of schizophrenia associated with infection and autoimmune disorder. And you can see if there's a history of an hospital contact due to one infection, there's an increased risk, significantly increased risk. If there is a history of 2 infections or 3 or more infections, always the risk later becoming schizophrenic increases. And if you have additionally an autoimmune disorder, then the risk increases even more. I told about the vulnerability to schizophrenic disorder. On the one hand, during the prenatal process, and also this stress plays a role, as we know. And there's one interesting study also in an animal model with a prenatal immune activation. We know in the meantime, as I have shown, that this prenatal immune activation is associated with an increased risk. But in the meantime, we know that stress in adolescence, and this is the topic of this science paper, stress in adolescence together with the prenatal immune activations induces synergistically behavioral abnormalities and also neurochemical changes in this animal model for schizophrenia. That means the prenatal immune activation is one risk factor, and it increases the vulnerability for stress-induced changes in the CNS immune response during puberty. You know, schizophrenia is a disorder which has a breakout mostly only after the puberty in early adolescence or in early adolescence. We have already heard about the role of microglia cells from Professor Pfizer, and I think one important point is that these microglia cells during life can be primed or sensitization. That means we know that different stimuli like neurodegeneration, also aging, but also stress can prime these microglia cells. That means if after this priming a second stimulus, for example, a systemic inflammation or an infection or stress comes to the individual, then the microglia proliferation and an increased production and release of pro-inflammatory cytokines takes place. That means the priming facilitates the re-exacerbation of this inflammatory pathology in the central nervous system. And these are interesting data from a meta-analysis published this year, meta-analysis of in the cerebrospinal fluid and the risk for major psychiatric disorder, not only for schizophrenia, but the red one is schizophrenia, the green one is major depressive disorder, and the blue ones are bipolar disorder. And from my point of view, the data from the cerebrospinal fluid, of course, are more valuable compared to blood values, because the cerebrospinal fluid is much more nearer to all what happens within the brain. And what you can see here, if we only look to the red bars, that there is an increase of these pro-inflammatory cytokines. Here, for example, interleukin-8, interleukin-1 beta, and interleukin-6 in the cerebrospinal fluid of schizophrenia, but interestingly also in depression and also in bipolar disorder. And there is the soluble interleukin-2 receptor, which is an anti-inflammatory marker, shows a decrease, interestingly, in schizophrenia. So these, from my point of view, are interesting data showing an inflammatory process in the brain of these schizophrenic patients. And Professor Pfizer already mentioned the tryptophan-kynurenine system, and as you can see here in this meta-analysis, also the kynurenine acid, I will come later shortly to the kynurenine acid, is also increased compared to controls, and also the kynurenine that is also driven by the immune system. I've told about the pro-inflammatory interleukin-8, and these are data of an interesting study where has been looked to the serum levels of the maternal interleukin-8 during the pregnancy and the relationship to the brain volume in schizophrenia. That means the maternal serum levels has been frozen, and after years look to the decreased brain to the brain volume, and what you can see here is an increase in the ventricular and in the ventricular CSF, and a decrease in the volume, for example, of the posterior cingulate and the entorhinal cortex. This is only a small study and a small pilot study, but very interesting results because it shows the relationship between the maternal cytokine levels on the one hand and the volume decrease in the brain of the schizophrenic offsprings. Professor Faisal had also mentioned the disbalance of the immune system in schizophrenia and the disbalance also of the Th1, Th2 or M1 and macrophage 1 and macrophage 2 system. And from my point of view, this is a pinpoint, and especially the monocytic and the macrophage system are a pinpoint in schizophrenia. And this is only, these are results of a study from a group from the Netherlands showing that there is a specific inflammatory monocytic genetic fingerprint looking to different pro-inflammatory cytokines, 9 schizophrenia specific genes. I don't want to go into details, and also an increased expression of inflammatory and chemotactic monocytic genes. And if we look to the activation of the microglia, and we can do this with positron emission tomography with a PET, and we can see an increased expression of the microglia activation marker PK11195 in schizophrenia, and also of another marker of the DAA1106. That means with 2 different markers of microglia activation compared to controls, we see that the microglia in schizophrenia is activated with this neuroimaging technique. And therefore, we are following this vulnerability, stress, inflammation hypothesis of schizophrenia. We know that, of course, during pregnancy, this is an important risk time, but also, as I have shown, later infection, on the one hand, possibly a pro-inflammatory immune state of the mother, or obstetric complications, we know also play a role, an infection during the CNS development, but also in later stages of life. There's a dose-dependent risk for schizophrenia and after an infection. And what happens in the brain? An increased cytokine release, an increase of the prostaglandins, a dopaminergic hyperactivity. We know that, for example, interleukin-1 beta can activate a dopaminergic neurotransmission, and the priming or the conditioning of the immune system plays a role for this kind of vicious circle. 1.5 years ago, there has been an interesting publication also showing from another point of view the possible role of the immune system. This is only a case report of a 67-year-old male without any psychiatric disorders, and he developed a chronic lymphatic leukemia, CLL, and he only had 1 sibling, 1 brother, and 12 years younger brother, and he was the only HLA matching family member. He had schizophrenia since early adulthood, but the bone marrow from this brother has been transplanted, and this patient reached full hematologic recovery, But around 4 months after the bone marrow transplantation, he developed acute psychotic symptoms the first time in his life, similar to his brother, auditory hallucinations, bizarre and non-bizarre delusions, and flattening of the affect. And despite antipsychotic therapy, these symptoms became chronic. That means it possibly, with the bone marrow transplantation, the risk for psychosis was also transplanted in this patient. The last point I want to mention are our studies with the COX-2 inhibitor, with the celecoxib in schizophrenia. This, I have mentioned these data before. This was our first study, and also it was an add-on study. That means all patients, due to ethical reasons, had to get an antipsychotic, but the one half of the patients additionally got an anti-inflammatory medication, the celecoxib, what we call the modern aspirin, and the other half got the placebo. And if we look to the results overall, after these 5 weeks, the patients who got additionally the COX-2 inhibitor had an overall better outcome. This study was replicated from a group from Iran in chronic schizophrenia, and also here a very similar study design with risperidone and celecoxib, and also here both in the measured by the positive and negative syndrome scale, here in this general psychopathology subscale, and also in the total score, as similar as our data, showed a significant better outcome compared to those who only got the antipsychotic. These are not huge effects, but the effects are statistically significant. We also had another study, and there was also another study from a group from San Diego at this time, from the UCLA, who showed that in chronic patients we did not see, or both studies did not see a really good effect in schizophrenia, and therefore we hypothesized that the effect of the anti-inflammatory medication depends from the duration of the disease, and therefore we performed a study with in first manifestation schizophrenia, and because most of the studies used the risperidone before, we used another one, the amisulpride, in a double-blind placebo-controlled randomized study in 50 schizophrenic patients. And also here we did see a significant better outcome of those patients who additionally got the celecoxib compared to those who only got the amisulpride. Here is are the negative symptoms of the patients. Here is again the global score, and this is the PANSS. Sorry, this is the PANSS total score. That means the whole schizophrenic symptoms. And similar results have been shown with the mixed COX-1, COX-2 inhibitor aspirin as an add-on therapy with schizophrenia. In the meantime, there are also published meta-analyses, and in this, but also in a further meta-analysis of a group from the US, we saw a positive effect of these non-steroidal anti-inflammatory drugs in schizophrenia, but it seems depending from the duration of the disease only in those patients who who were treated shortly after the onset, not in chronic schizophrenic patients. Due to time, I don't want to go here into more details regarding the tryptophan-kynurenine metabolism, but what I showed in the cerebrospinal fluid, there was an increase in the cerebrospinal fluid of the kynurenic acid in schizophrenia, and the kynurenic acid is an NMDA receptor antagonist, and interestingly, the metabolism is driven by pro- and anti-inflammatory cytokines. That means pro-inflammatory cytokines increase the production of the kynurenine acid, but can also increase, for example, the risk of neurotoxic metabolites like the quinolinic acid, which seem to play a role in depression. And yesterday I have shown data that in dementia, the 3-hydroxykynurenine may play a role. If we look to the pathology of schizophrenia, we know that the genetics play a role. Of course, the neurotransmitters like serotonin, dopamine, NMDA plays a role, neurodegeneration, and they all contribute to the psychopathology. But we think that in this scheme, the inflammation and the immune system is lacking. Additionally, the immune function and the inflammation, the role of stress in the pathogenesis, and also the tryptophan kynurenine system plays a role. Let me shortly summarize. There is evidence for a slight inflammatory process in schizophrenia. We know that the COX-2 inhibitors, they rebalance the immune response, and I had not the time to speak about depression, but the COX-2 inhibitor celecoxib add-on to antipsychotics has therapeutic effects in schizophrenia in patients with a short duration of the disease especially. There are also other compounds, interesting compounds. There was already a discussion about the omega-3 fatty acids, also some results about virostatics, erythropoietin. Glutamate modulators are also related to the immune response via the tryptophan kynurenine system, and altogether the anti-inflammatory therapy seems to be effective in major psychiatric disorders, and I hope I could show you that especially in schizophrenia this may be an important therapeutic step in the future. Thank you very much for your attention.